Oxford AstraZeneca COVID-19 vaccine brought in by COVAX and partners was received in Abuja, Nigeria, on the 2nd of March 2021. The country appropriated to Edo State, numbering 81,080 doses of the vaccine, arrived in the state on the 10th of March at about 8:25 p.m. The rollout of these vaccines will be in 4 phases. The administration of this first phase of this vaccine, scheduled for the frontline healthcare workers, their supporting staff, and strategic leaders in the state, will commence on the 15th of March 2021. His Excellency, the Governor of Edo State, Mr. Godwin Obaseki, will officially flag off the 10-day campaign on Monday, March 15, 2021, at the new Festival Hall, Government House, here in Benin City. However, healthcare workers, especially the frontline healthcare workers, have an additional job-related risk of getting infected. Hence, the administration of the vaccine to them is of top priority. Other groups with greater risk of the severe disease include the weak and elderly, people with chronic illnesses like diabetes, heart disease, hypertension, and people with conditions that lower the body's immunity. There is currently no drug that provides cure for COVID-19 disease. However, non-pharmaceutical measures, including the use of vaccine, help to prevent the transmission of this disease. We should therefore continue to adhere to all basic prevention measures, including vaccination, and continue with frequent hand washing with soap under running water, avoid close contacts, regular use of face masks, and to adhere to all government preventive protocols for COVID-19. As part of the preparation for the introduction of COVID-19 vaccines in the state, healthcare workers have been duly trained at national, state, and state levels, and the same trainings are being cascaded to the local governments and the facility levels, where the vaccines will be administered. Also, all the key materials and consumables for the vaccination are being distributed appropriately to ensure successful implementation of the vaccination campaign in the state. This first phase will be administered to frontline healthcare workers after an electronic self-registration, while the second, third, and fourth phases will include administration of these vaccines to elderly, those between ages of 18 and 49 years, with comorbidities, and the rest of the eligible populations between the ages of 18 and 49 years, respectively. This will enable us to avoid crowding at vaccination posts, as the registration or the registered health center healthcare workers will be scheduled and maintained for their vaccination date via reminded for their vaccination on dates that will be sent to them via SMS and emails. The vaccine is a liquid formulation stored at a temperature between +2 degrees Celsius to +8 degrees Celsius. It comes in a 10-dose vial, and it's administered intramuscularly as 0.5 ml per dose. Only 2 doses are required for full protection, given at 8 to 12 weeks interval between each dose. Please note, this vaccine is under the WHO emergency use listing, and it has been approved by NAFDAC and is considered safe for use in the state. Be aware, therefore, that COVID-19 vaccines in the state are safe, effective, and they will be administered free of charge to every person taking the vaccine. Healthcare workers will be available at vaccination posts to give answers to questions relating to the vaccine safety and the management of possible side effects that could arise from the vaccination. I urge all eligible citizens to be patient, as everyone in the designated groups will eventually be given the vaccine. As the vaccines arrive in batches, those citizens will be informed on how they will receive these vaccines. Once again, I want to assure the public on the safety of the COVID-19 vaccines. I also crave your indulgence to continue to support the Edo State government in conveying truthful, factual, and objective messages in order to dispel negative rumors around COVID-19 vaccines and the government's effort to protect citizens against the disease. While the vaccines will give long-lasting protection against coronavirus infection when the complete doses are given, in the meantime, let us continue to adhere to all the general preventive measures already instituted in the state. These include washing our hands frequently with soap under running water for at least 20 seconds, or use of alcohol-based hand sanitizers. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with anyone showing symptoms of respiratory illness. Maintain at least 2 meters distance. Cover your nose and mouth properly with a tissue paper when sneezing or coughing, and dispose this tissue paper properly. We may also cough into our flexed elbow if a tissue is not available. Obey national and state directives on avoiding large gatherings. And finally, get vaccinated at the various designated vaccination centers in the state. As you all know, Edo State has been in the forefront of the fight against COVID-19 pandemic and has served as a good example for other states in the response to this pandemic in Nigeria. This is largely due to the commitment of the government and the enormous support of the people in ensuring that Edo people enjoy good health. I therefore appeal to citizens of the state. I therefore appeal to citizens of Edo State, healthcare workers, frontliners, and all strategic leaders to make sure that this vaccination exercise is successful by ensuring that they are vaccinated. Vaccinators will be in several designated facilities, temporary field posts to vaccinate patients or persons who must be vaccinated. Do bear in mind that after vaccination, all COVID-19 guidelines should still be adhered to avoid possible reinfection. Finally, on behalf of the government of Edo State, I want to commend the efforts of the State Ministry of Health, the National Primary Care Development Agency, the partners, particularly WHO, UNICEF, and Gavi, the press, and others for their wonderful collaboration in our collective drive to ensure that coronavirus disease becomes a thing of the past in Edo State and in Nigeria in general.